Using like a headband.
Okay.
Okay.
And I don't look that way, I look at you. Okay.
You're talking to me. Forget the camera's even there.
Okay.
Okay. Action.
Okay. Good morning. Please tell us your name.
Hi, my name is Jody Staniford.
What is your relationship with Tri-State Community Health Center and for how long?
I've been a patient of Tri-State Community Health Center for the last 5 years.
How did you come to be involved with Tri-State Community Health Center? How did you become a patient here?
I became a patient here in the fact that many of the doctors in our community work together to establish the Community Health Center and open it, and I had my trust and faith in them. And it was a much needed resource for our community for numerous people.
Talk about your experience the first day you walked into the clinic. What were your feelings? What were you put at ease once you received care?
My feelings when I first walked into the health clinic were that we were going to once and for all have a community health center to help many of the patients that were not able to benefit from health care that they desperately needed. I was going to be one of those patients. Even having regular health insurance is an asset when you live in a tri-state area because it doesn't travel state to state always. So we were really in need of this community health center to benefit in so many ways.
Are there other community health centers in the area, or is this a primary one and very important to the community?
This is the primary and the only one that I'm aware of, and it is very, very beneficial to the community. Without this, I cannot even imagine how desperation people would be. This is the only asset that they have for a resource to them.
Would you recommend the services and for other people in the community to come to Tri-State Community Health Center?
I would definitely recommend these services and other people to come to the community health service here. It is of the utmost. I appreciate what they've done. I have faith in them. I put my life in these doctors' hands every day, and I know that they put their selves out for us.
If you could thank someone in the Tri-State Community Health Center, who would that be and why?
I would thank Dr. Paget because from the get-go he's been one of the forefathers of this to be developed. I would also thank Zarina, who has saved my life and been there each and every day for me. I have just the utmost faith and the utmost appreciation and gratefulness to them all.
What are some unique challenges patients or individuals in the community face getting access to care in the tri-state area?
To see specialists and stuff is a big problem for them. To get to see a primary doctor is a huge problem to them. This is where the clinic brings in those assets and helps to guide them through one step at a time. Jennifer is a wonderful asset to the clinic. She works with you on a personal level and really tries to meet all the needs you need and get it taken care of.
Did you always have access to health care prior to coming to Tri-State? And if not, where did you used to go?
No. We used to have to travel all the way back to San Bernardino County for our health care.
What would have happened to you if you had not been able to access health care at Tri-State?
I probably would have died.
How important is that to you? What does that mean to you?
That means everything to me. My life, my living, my everything that you can imagine. Many people here have no access to anything. I was a lucky one that made it to San Bernardino. Many don't.
How do you feel the community perceives Tri-State Community Health Care, the services here?
I feel the community perceives it and is very grateful for each and every day that it's here and it exists. It is a great asset to so many of us.
Tell us about your background, your community role. You tell us a little bit about the past job and start this response out with me. I previously worked as.
I previously worked as a medical assistant and phlebotomist, and at that point even I had to travel 50 miles away to work in Havasu. the Tri-State Clinic now brings those assets here to the community. I left working in office because I felt the need was greater needed on a personal level with the people, which I became home support instead. The clinic has helped me reach out with those community members to get them the care that they so much needed in so many different directions of life, you know, from wheelchairs and things to medication to routine appointments to blood work to just everything necessary. This is such a grateful benefit to an asset to this area that you cannot even imagine. It's unforeseeable that it would not be here.
Knowing your other residents that live in the community, what do you think are some of the major health needs in the community? What sort of diseases, conditions, is drug abuse an issue? Just kind of talk about and start this off with some of the other individuals in our community need.
Okay, some of the other individuals in our community have issues with drug addiction, have issues with mental health, have issues with handicap devices, even as far as oxygen. I still have to receive oxygen all the way from Lake Havasu, 55 miles away. Those assets are needed if we can further grow the clinic, would be an asset to so many people. I know that other people in other places from Laughlin and things, they also come to our health clinic and utilize our services, as they have none either. The closest for them would be in Las Vegas, which is an hour and a half away from them. So we really are in a rural area and in need of resources to simply have health out here and have livable conditions to exist.
How important it is, do you think, to the health center that they get federal and state funding to help support the work they do, because of the rural nature and there's jobs, it's hard to recruit. So start this off with having federal and state funding to support our services is important.
Having federal and state funding to support our services is very important to this community. This community exists of a lot of people with health conditions, a lot of people that are seniors, a lot of people that are disabled, and a lot of people that are without employment. Those people are still human beings in this world and deserve to have it. Federal funding helps those people to receive the quality care that is necessary for their health and their life.
In final question, what is the biggest strength and value that the community health center brings to the community? And start this off with the biggest value this health center brings.
The biggest value this clinic brings to the community, I feel, is the access and availability of health benefits. Medication, doctors, resources, all of those things necessary to simply make a person's life easier on a day-to-day level so that they could gain health conditions that are livable.
Is there anything else we didn't cover that's important that you want to say while you're here today? I don't have any other questions.
Okay.
But I want to make sure your essence and your voice is heard.
Okay. Yes, I, for one, as a patient, am grateful. Please help.
We're good.
Cut.